Hi, in this video we'd like to discuss Antai Hospital's new policy for Hyperemesis Gravidarum remote treatment. Now, in this video we'd like to announce effective immediately that we are halting and stopping this remote treatment of Hyperemesis Gravidarum, this new program that we've introduced over the past 2 months. We have tested it out and we have assessed that it is not suitable for our patients to actually have this remote treatment option. Now, there are primarily 3 core reasons behind it, but you as a patient, you do not have to doubt the effectiveness of our HG vaccine. We have several patient testimonies. You can check out videos of patients fully recovering from this condition after receiving our HG vaccine. We have group chats of previous patients, up to 200, 300 patients. All of them have testimonies on how effective our treatment is. So this treatment is working. However, this new program, which is the remote treatment option, was recently introduced to help our international patients, to help patients who cannot come to the hospital due to distance and also severity of their condition. Antai Hospital wants to help our patients, that's why we introduced this. However, we've encountered some issues and we still believe that patients, for the best treatment outcome, you should still come to the hospital physically and also receive the treatment at the hospital with our nurses and doctors. So for our international patients, we want to apologize, especially a recent one as well, from UK, from the United States, from India. Many of them have already inquired and seeking this remote treatment. We've encountered some issues. Now let's go to the 3 core reasons. First of all is that many of our patients are seeking reimbursement for the remaining vaccines that we've given them. So let's discuss this via an example. So let's say a patient seeks this home treatment, and then the hospital has sent a certain amount of vaccines via syringes and also oral medication. Because of how effective the treatment is, you do not necessarily need to use the entire dosage. Maybe you just need to use 3 to 4 injections. These patients, when they already see recovery within 3 to 4 injections, some of them fully recovered, they are seeking reimbursement by returning the remaining of this medication. For example, the injections and oral medication. But when you return medication to the hospital, it's no longer usable because we do not want to know if it's contaminated or whether the contents are in fact usable, and also it may actually increase financial burden for us as well, because we are seeking to help you in the first place, yet these patients, after they are recovered, then they are trying to actually pull a leg on us by asking us to refund their remaining of the reimbursements of the remaining medication. This is something that we cannot do, and we've encountered several arguments with our patients and they giving us nasty remarks and also affecting other patients from seeking our treatment when they are discussing, sharing this type of gossip. So we want to shut that down, and we need to still continue asking our patients to come to the hospital, because we've encountered several patients doing this. These are nasty tactics that we do not tolerate. Our goal here is to help you overcome hyperemesis. Secondly is the encounters of potential side effects that cannot be managed. Because of how complex Hyperemesis Gravidarum would be, without a proper guidance with the presence of our certified nurses and doctors, potential side effects may occur because there's no one monitoring your condition, and you don't want to jeopardize any type of a situation, especially fetal health and maternal health. This is actually very irresponsible for the doctor to do, and also very dangerous for the patient to undergo. That's why we believe that patients no longer can do this treatment at home. Even if you do have a certified nurse, they still do not have the experience and expertise that we have, over the past 20 years that we've seen different types of HG. This is one of the reasons as well, to minimize risk and also for the safety and well-being of the patient. Thirdly is the pandemic, which is the COVID-19 restrictions. This was also another reason why we introduced that. Even within the country, many of them cannot get to the hospital due to travel restrictions, and it's much more worse for international patients. So now it's because in Beijing there is no more strict restrictions as well. As long as you have your COVID vaccination status, you can easily come into the city and get into the hospital without any queuing as well. So it's not as strict as before anymore. So even our international patients, you can travel to Beijing now. It is doable, unlike before when it was completely unavailable. Now that restrictions have loosened, this gives more incentives, and also more patients can actually directly come to the hospital, which is the best recommendation that we do give to our patients as well. Physically present in our hospital, then you can enjoy full effective treatment very quickly, and you can go home as well. With these three core reasons behind, as we discussed, management has decided that we need to stop this remote treatment so that it can cause no more further damage to Antai's reputation. And we also want to reassess our strategy. Maybe we might introduce this in a different format in the future. For now, we still urge our patients to physically come to the hospital. And if you cannot, especially for those who are especially severe episodes, we can have an exception by sending you few doses of this HG vaccine so that to stabilize the condition and then allow you to actually board a plane or a bus to actually reach the hospital and receive treatment. You will still need to come to the hospital at the end of the day, but for severe cases like this where they cannot stand, eat, travel, we will make an exception for you. But the conclusion is that you will need to come to Antai Hospital for our HG vaccine now. I hope that you've understand this information, and if you'd like more clarifications on our HG vaccine program, how you can receive it, how you can travel to us, if you need medical endorsement letters from our doctors for travel, please get in touch with us via the website. You can also leave me a comment down below for more inquiries. We will be happy to answer your inquiries. So please stay tuned to the next video and also leave me a comment down below.